everybody, it's Dr. Joe and Sleeping Cowboy Bear, and today I'm going to show you my 7 best advanced knee pain exercises. So let's get started. Disclaimer alert, disclaimer alert. So these are advanced exercises. You might not quite be ready for these yet. I have a beginner and a moderate, so go check out those first before you come back here just to make sure that you're ready. So the first one is going to be a single leg bridge. And it might not sound like a lot, but it is tougher than you really think it is. So with the single leg bridge, you can do it a couple different ways. You can just bring one leg up. You can bring it up closer to you, which does make it actually a little bit harder. But the goal is to keep your hips level. So if I'm coming up, I don't want this hip to drop. If I was going like this, that means I'm not quite ready for that single leg bridge. So you can keep that leg out like this and come up, or you can bring it a little bit closer towards you and then come up. And so that does work everything a little bit more. So again, just starting off with 10 to 15 of those, you can work your way up. Do 1 to 2 sets a couple times a day. But remember, if that's too much, go back to some of the other videos that aren't quite as advanced. So we're going to do the rest of them standing up. So the next exercise is going to be a full squat. With squats, if you haven't done them before, make sure you have a chair or something behind you, but since this is the advanced exercise, you shouldn't need a chair because you should have already done the other exercises. So with a squat, you want to have your feet about shoulder width apart or slightly further than shoulder width apart. You want to keep your toes pointing forward, and when you squat down, you want to be able to see your toes, so your knees shouldn't go in front of your toes. So that means you really have to kind of stick your booty out when you're squatting. If I'm squatting like this, all my weight goes into my knees, and we're trying to strengthen our knees, but we don't want to wear out our knees. So this is great to get those quads working, those hamstrings working, those all cross the knees. But make sure you're using correct technique. Keep equal weight shift on your toes and your heels so you're not going too far forward and you're not going too far back. And when you squat down, keep your back in a straight position, but you can bend forward at your hips, hinging it a little bit. Now, I know a lot of people will tell you a little bit differently with squats, but I like to even myself out. So if my booty goes back, my chest comes forward, almost like a hinge squat. Some people will really try and get you to come straight down, but I think this is a better way to start because you can keep your back a little bit straighter. And then once you get comfortable with that, going into that squat, almost like if you had to squat onto a toilet, that's what you would do. You're really sticking your booty back. But eventually, then you're going to bring your back up just a little bit more to get that squat. But make sure that you're able to see your toes when you're squatting. So when you're starting off, again, I just start off with maybe 5 or 10 because you don't want to overdo it. So then the next one is doing a squat with a ball squeeze. And this is going to help activate those inner quad muscles, or your VMOs. And again, this is a little bit of controversy in the therapy world of the VMO having a lot to do with the tracking of your kneecap. Either way, I would say it's really important to strengthen them. So what you want to do is get a ball about the size of a basketball, soccer ball, or volleyball. You don't want something small because you still want your knees to be about that shoulder hip width apart. And so you're still going to do the same squat with all that same technique, except now you're squeezing into the ball while you're squatting. And so the ball might want to slip a little bit, so make sure you get it nice and comfortable. I have a little bit of air out of mine so I can squeeze a little bit more. But you still want to do that same technique and make sure you're squeezing while you're doing it. Sometimes people forget to squeeze the ball, but that's what's going to help activate those other muscles. So again, since this is doing something that you might not have done before, maybe just start off with 5 or 10 and then kind of go from there. So then the next one is going to be doing a sidestepping motion with a band. And while I put the band on, I want to give a shout out to my wall of thanks folks. And that's going to be Mark, Andy R., Jim L., and William B. And if you are interested in being on my wall of thanks, make sure you click on the link in the description below to find out how. So with the band, when you're doing these sidestepping, you can either have it above your knees, which is a little bit easier, or you can have it down by your ankles, which makes it a little bit harder. So I'm going to start off just above my knees. And what you really want to do is make sure to get working those muscles around the knee to help strengthen that knee. Put yourself in a little bit of a squat or a bend. So you're not doing a straight step sideways, but you're starting off with a little bit of a squat, and then you're just kind of stepping side to side. Now I'm not taking big steps just because I'll run out of room, I'll fall off the camera screen, but if you want to just go 10 feet one way and 10 feet back, you can. Just try and keep yourself in that slightly bent knee position without coming too far forward. So you're just making sure that all these muscles are activating while you're stepping. So you don't have to bring your feet all the way together. You can, or you can just kind of take a normal step as you go. But that's really working all those muscles around that area. If you go a little bit lower, that's just going to make it harder because it's a longer lever arm, what we call, which means you have to pull out a little bit more in that longer length. And so it makes it a little bit harder, and it just works the muscles a little differently, so you can do both of those. So then the next one is just going to be a 4-way hip with the band. And so even though it's a hip exercise, all these muscles come down and cross that knee as well. So it's really a good knee strengthening exercise. So you can do this not holding on to anything, but if you haven't done these before, you might want to have a chair or a countertop next to you just for a little bit of balance. So what you're going to do is keep one leg still, and you're going to move the other leg. And you really want to do both sides for this, but when you're doing standing exercises, because if my left side was the injured side, if I'm standing on this one and moving this one out, I'm having to stabilize. And then if I'm standing on this one and then moving it out, then I'm using it in a motion. So it's working the exercises, it's working the muscles differently, as in, you know, an open chain versus a closed chain. So you're just going to kind of do all the directions. You can either do all your hip flexions at one time, or you can just alternate around and do all your movements. So I'm going to stand sideways so you can kind of see what I'm doing. I'm just going to work my left side so you can see it. So I'm coming forward for that hip flexion. So I can either do 10 of them like this. Try and keep your upper body pretty upright, so I'm not swinging back. I'm getting all that movement at my hip and my leg. So kicking forward, or you can kind of go like a clock. So you can go out to the flexion, abduction, extension. And so you can do the across, you just won't have the resistance of the band with that. So if you want to do them all one way, you can, and going out. And I'm tapping down just a little bit to reset. If you want to make it harder, try not to ever put your foot down. So then when you're going back, you're just trying to do that motion. And then you can do some just going across as well, but it won't be quite as much resistance. But again, make sure you're doing both sides because you're working it differently. You're working it in a closed chain for stabilizing, and then an open chain for getting that movement with it as well. So then the next one is going to be a single heel raise, single leg heel raise. And so again, if you haven't done these before, you might want to have something to hold on to for a little bit of balance. But you don't have to if you feel like, you know, you've done these and these are pretty easy to do. So it's just like it sounds. You're single leg and you're raising up your heel or lifting your heel. And again, as you can see, there's a little bit of balance going on. So that's fine if you're a little wiggly. That's pretty normal, especially if you don't have shoes on. That usually makes it a little more difficult. But really try and control it coming up and down. So you can see, even though I'm wiggly, I'm not just doing this for momentum, because that makes it easy. You can see this a lot easier for me to do it that way. So really try and control it coming up, and you can see, again, it's a little difficult for me to do on the mat, but if you feel like you need something to hold on to do the first couple ones, you can. But really try and make it a smooth, controlled motion. If you have to put that back leg down, just maybe a toe as a balancer, you can do that as well. But that's really going to work those calf muscles. And again, those calf muscles cross that knee joint, so it's really helping to strengthen that knee. So then the last one is going to be single leg squats. So after you have all the regular squats down, you feel really comfortable. Again, this is one where if you need something to hold on to, make sure you're holding on, because it's a little tougher than it looks. But again, you want to get really good form with this. So if you're not going down as far to start off with, that's fine. So you're really still sticking your booty back and then coming back up. So you can see I'm not going to start off really low. I'm just kind of squatting down and coming back up. But the key is to try and keep your hips level. So I'm not dropping my hip as I come down, and I'm trying not to have my knee collapsing in. And that one's always a tough one for me because my knees kind of go in anyway. So really focusing on trying to get that smooth motion coming up and back down. So again, if you feel like that's too hard, maybe go back to the moderate video, or make sure you're holding it on to something while you get the technique down, and then you can go 2 hands, 1 hand, 1 finger, and then do it without anything. So Bear's finally awake after the 7 best advanced knee pain exercises. If you'd like to help support my channel, make sure and click on the link up there. And don't forget to subscribe. Where, Bear? Down there? Yeah. And remember, be safe, have fun, and I hope y'all feel better soon.